Good evening once again, and welcome to Neuro Digest here on Science TV. This is our 6th episode, and today we're going to be having our second guest, Mr. Mwangi, who is a speech therapist. So we would like to request our viewers to share the questions if you have any on nonverbal children, what, where, why, and how, because today we have an expert. I know we have touched on some of these issues in the previous episodes as some of the signs and symptoms of neurodiversity, and we are not forgetting that as we go live, we have our sign interpreter, Maureen Maida, and she will be our sign interpreter for today. On my left, I have Mr. Asaf John Mwangi.
Hello, viewers.
Yes. So we shall be diving into the topic of speech therapy and why it is done and what is the benefit. And he will explain to us, since he's the expert and he's a teacher of special needs children, he can explain to us more about this topic. I know we just touched on it, but let's hear it from the expert. Karibu sana, Mr. Asaf.
Thanks very much.
Okay, you can start by informing the viewers who you are, where you do, what you do, exactly, all of that and more.
Okay, thank you, Science TV, for giving me this opportunity to talk to the viewers, especially the people or the parents, teachers, and other professionals who work with children in the spectrum. My name is Asaf Mwangi. I'm a teacher, and I'm also a speech therapist. My first degree is Bachelor of Special Needs in Education, Master's in Speech and Language Therapy.
Good. So at least he knows what we're going to ask, and we know he has the experience because he works in a school and he handles our children. Actually, he's Andrew's speech therapist, and I can say I have seen a lot of progress in the past 1.5 years, right? Yes. That he has been with him. And we'd like to know, first of all, how does this issue of children being nonverbal come about? Like what is the cause, or how do we explain it? In layman's language, we say nonverbal or lack of speech, or we have things like echolalia and all of that. So would like to have you elaborate to the parents and all our viewers, like, how does this happen? How come it comes about as one of the signs and symptoms of neurodiversity? Karibu.
Yes, thanks very much, Mora. When you talk about autistic child, and we talk about the speech and language, we forgot to go deeper and we talk about the communication. Because when you talk about the speech and language, the umbrella term is what we call the communication. And in the definition of what is autism, what comes up is difficulty in communication. So when you talk about the communication, in a layman term is how we express our feelings. Yes, how we express our feelings and our thought. So it must have from a listener to the speaker. So for you to communicate, you must be able to have a listener and a receiver. And when you talk about the communication skills, that's where we should be starting from.
All right.
Most, not all of them, but most of the learners with autism, they have difficulty in communicating their feelings, their ideas, their opinion, their words, and their wishes.
Okay.
Yes.
So now, when we say they have difficulty in communication, because the one thing I usually don't quite get to understand is a child can sing, right? But they cannot have a conversation with you. But if you put on music, they understand the rhythm, they can sing along to that. But when it comes to engaging them, like having a conversation, the way I'd say, how was your day? You know, and then now they process that and like, give me feedback. That's what you're saying, communication is among two people.
Yes.
So what seems to be the challenge? Like that, what is it that is not happening, that they're not able to actually process what you're trying to tell them?
Good. Yes, we are saying that is a spectrum, right?
Yes.
So one child is totally different from others. Let me start from some basic thing. When you talk about speech and language, because language is the medium of communication.
Okay.
And we use language to communicate. And this language can be non-verbal or verbal. Can be written or signed, like what our sign interpreter is doing.
Yeah.
She is communicating using language.
Okay.
So now, using sign language. So to her, sign language is the medium of communication.
Okay.
Yes. So and when we talk about child with autism, when it comes to language, it cut across both the verbal and non-verbal.
Okay.
Both receptive and expressive.
Okay.
So let's go back. They may have difficulty in understanding what is being said.
Okay.
They may have difficulty with expressing themselves, but they are okay in understanding.
Okay. Okay.
But we can have a case whereby there is difficulty in understanding language, and there is also difficulty in expressing language.
Okay.
And they can have okay with understanding language, which is the receptive language, but they have an issue with the expressive language. But now let's come to the language. When we talk about language, and let's now talk about because a child of 2 years, we are talking about the body language and the verbal language. We cannot go to the written language.
Okay.
And we see that this child, especially what we call, let's go back to the types of the spectrum, because we know that there is the classic autism, and there is the high functioning autism. And these are two different things. And they manifest differently when it comes to the speech and language.
Okay.
Because when you get a child with classic autism, you may have a mute child, totally mute, no speech,
Okay.
mute. You may have an echolalic child
Okay.
who is there, the speech is there, but it's mainly echoing. You ask him or her, how are you? How are you?
Okay, so because we have, for me, I understand what echolalia is, and I know we had put it out on our Facebook page, and it speaks what it is. But for any new viewers or any parent who does not understand what echolalia is, could you kindly elaborate what is echolalia?
Echolalia is merely repeating words or phrases which a child with autism has heard before.
Okay.
It can be immediate, or it can be something like past echolalia, something which child has heard maybe 2 days ago or 1 day ago.
Okay.
Yeah, it can be a delayed echolalia, or it can be an immediate echolalia. Let me give you an example of a child whom I used to teach who had a delayed echolalia. He could listen to the news, maybe yesterday 7 p.m. news.
Okay.
And when he came to school, he was able to recite all the news
The entire news.
The entire news.
But isn't that genius? Like, isn't that? No, I'm trying to understand, because I also came across a child like that. Like, they opened a book and they were, because there are photos, they could read what is there. Not read because they can't read, but he was repeating. So when I asked the mom, like, is he able to read? And he was like, no, it's because I have read that page. So the child actually knows this page, this is what is written, but yet they don't know how to actually tell you this is letter A and it sounds like this. If you ask me, I'd say that's like utterly genius. Like, we should find a way of how we can make use of that. You know, those are best spies. If I was to give them a JD, I think of a spy who, or a recorder, where you want to walk in somewhere and you need to play back everything, but then you don't want to be caught with the gadget. I'd actually take an autistic child who is echoleric to go and do that job for me.
To me, it's something what we call the super memory.
Okay, all right.
Because they're able to memorize even where the full stop was. And even the presenter coughed, they'll cough at that time.
Oh no,
So,
like they will A plus anything
Exactly.
else on top of whatever it is that was spoken.
But ask them the context or the meaning of the news.
All right.
They have no idea.
So the processing of what they have heard is the challenge. It's not that they are not hearing. They can hear, but processing the
meanings is not there. What we call now semantic part of
the semantic part of communication.
Yes, of communication, knowing the meaning.
Okay.
But they are able. It's just like what you had asked before about they are able to sing. I myself can sing Ohangla. I can sing along, but do I know the meaning of those words?
No, you don't.
No.
Yeah.
I can sing the Congolese lumba. Those French songs.
Yeah.
I can sing along, but do I know what they mean?
No, most of the times you don't know.
Yeah, I don't know.
Yeah.
So you see.
Yeah.
But can I be able to communicate in French? No.
No.
Can I be able to communicate in Lingala? No. You see, can I be able to communicate in Luo? No, but I can sing a no hagla song. So the part of the brain which deal with the music and the part of the brain which deal with the communication is totally different.
Okay.
Because for the music has to do with some emotional aspect of it.
Okay.
And also memory. You have to remember this word. And the way the song is, the way the words are arranged, they'll never change.
Yeah.
And singing is not spontaneous. But when it comes to the communication, it's very spontaneous. You come and ask me, how was school?
Yeah, you need to process how school was and give me feedback.
Yes, and how school was yesterday is not the way it was today.
Yes.
But if I sing the song Baba Black Sheep, the way it was during our dad's time,
it's still the same.
The same one.
Maybe
the
visuals.
Yes.
Wow.
Yeah.
Okay, that's quite interesting. And I like the way you have explained that the different types of communication, that is me, the receiving, processing, and actually engaging, so that the child has to first process it before they can give you feedback. And that's where the challenge is most of the time. So when it comes to now written speech, is that like how long tentatively would we get worried as parents of children who are non-verbal, meaning that they don't have speech, right? And how long should I give my child before I get extremely worried? Because we know we have, like, for example, Bradley started at 3, Andrew started at 5. Yeah, Daniel, my firstborn, by I think the second year he was already talking. So right now, I mentioned this last time, when I see a 2-year-old child talking, it's something that I get so shocked over because I cannot relate to that. So when should a parent get worried, like really worried, and start looking at either going for therapy or seeking help? At what point in their child's development should they do that?
Yeah, it's a very simple but a complex question, yeah?
Okay.
Any typical child, if a child by 2 years they are not able to converse, then there's an issue.
Okay.
And having a child who is not able to communicate, it does not mean that they're in the spectrum.
Okay.
It could be some other issues.
All right.
Yes, but it also raises a concern. If a child is not able to get the eye contact, we know that the simplest way of communication is an eye contact. Okay. If I talk to you when I'm looking down, how would that be? Even if I'm so fluent, how would that be?
I feel disrespected most of the time. Yes, I feel disrespected.
But we can communicate just by eyes, using the eyes. So a child of 6 months, even some few months, they look upon their parents, they try to reach their parents, yes, and they make an eye contact by 4 months. So if you see that a child is not giving you the eye contact, and sometimes they give but they cannot be able to maintain the eye contact, then there are some few question marks.
Okay.
Yes.
So that is the very first thing, very first form of communication between a mother and the parents and the child is eye contact. So that's the first thing we should. The minute we note that there is no eye contact, that's a red flag. Then by the time it gets to 6 months, there is no improvement. Mark another red flag. By the time it's 2 years, now consult and see a specialist. Okay. Then there is this other story about looking still at the communication aspect of it. We have had very many misdiagnoses where we have children being taken for surgery or being assumed to be deaf. So as a parent, when I'm engaging a child and I'm not getting any feedback, that means they're not looking at me or they're not answering me back. And we've had cases where they're totally not emotional. They can't even, like when you do tickle, they don't even smile back or anything. Yeah, those are some of the beginning signs and symptoms we're being told to look at. So as a parent, how do we tell apart between a child being deaf and a child having delayed speech?
Good. In communication disorder, because I'm still going back to the foundation, the roots.
Okay, the roots of
the communication, yeah? When we talk about the communication disorder, we divide it into 3 areas.
Okay.
And the very first thing is the hearing.
Okay.
If you can't hear, you can't speak.
Okay.
If you cannot speak, you can't be able to develop the speech and language.
Okay.
So we have to rule out the issue of the hearing. And when we talk about the hearing, we don't mean that the child is deaf.
Okay.
Because the hearing has its own graph.
Okay.
We have the mild, moderate, the profound.
Okay.
If a child is has a moderate hearing loss, what will happen? they may not be able to hear the way we are speaking it. A normal conversation, they get lost.
Okay, like, is it about the tone or is it about what?
The decibel, the loudness.
Oh, the pitch.
The
pitch of the voice. Okay.
If a child is severe to, it's moderate to severe, they can only hear sound like a bang of the dog or a helicopter passing.
Oh, okay.
So the way we are talking, a child with a moderate to severe hearing loss will not be able to hear. And also we also have all the speech sound. We know that the speech is made of sounds. Words are made of sounds. There are some low frequency sounds like boo, poo. Those are low frequencies.
So the O part of it is what is low frequency.
Yes. But now when you go to the high frequency, like said, there's some children who may not be able to hear. So the hearing test at which level the child is able to hear.
Okay.
And which frequency sound the child is not able to hear.
So that frequency, I'm learning today. You see, I'm actually taking notes.
Yes.
Today I'm a thorough student.
So there's the high frequency sounds. So you may ask us to say the word spoon, and they are saying poon.
Oh yeah, I've experienced that. That I can attest.
But it's
to,
because they cannot hear this.
So what do I do? Do I increase the volume when I'm saying this?
That's why it's good to rule out the hearing loss. And it's only in Africa, but in other developed countries, after giving birth, about 8 months, the child should go for hearing test.
Really?
But there is free. So yes,
for us we have to put it on the budget, like we have this.
And after some few months also, there's another screening which is free.
Okay.
In the kindergarten, like in US and UK, they also do those tests, the hearing test.
Oh, before enrollment, that is.
Even if the child is there, I think they do about three it's some few months after birth, and after some few months, yes. But they do it. It's catered for by the government. Yes.
We just hope and pray that one day we will get there. I would like to take a break and actually process all of this, then I can at least realign myself. So thank you, viewers, for those joining us live on Facebook. Thank you for joining us. Those who are at home, thank you for joining us. We're talking to Mr. Mwangi Irungu Asa. He is a special needs education teacher and a speech therapist at that. With me, my interpreter is Maureen Maitha and myself, Sylvia Moramo Chabo. Kindly send us your questions either on Facebook or you can SMS us on 20508. I'll say that again, 20508. So send us your questions so that we can engage Dr. more and get to know exactly what we look out for and anything that he could have said that you'd like to be expounded, because we're here for you. So see you shortly and stay tuned. Don't go far away. Thank you. Welcome back our viewers, both on Facebook and those who are seeing us live on the station. Welcome back to Neuro Digest with me, Sylvia Moramo Chabo, my interpreter, Maureen Maitha, and today we have our special guest, a speech therapist with 18 years of experience, who's taught very many students who are autistic and who are neurodiverse in very many ways. We have Dr. Mwangi Asaf Irungu, who's taken us through the basics of what communication and speech is. Today I learned that there is a difference. To me, it was always the same. So I'd like to take him back a bit to, we had discussed earlier that there are different types, or rather, the spectrum of autism is segmented into like 3 sections. The low functioning, high functioning, and the medium. We're trying to change the narrative to say the ones who need more support, who need less support, and those who might not need a lot of support per se, right, Dr. Yes. So engagers, how is speech related with now the entire spectrum on that side?
Thank you, Sylvia. I'm not a doctor, I'm a therapist and a teacher.
For us, a therapist is a doctor, and we shall live by that. Yes, Maureen?
Yeah, according to DSM-5,
okay.
Diagnostic Statistical Manual 5, autism, which is a spectrum, has been divided into some few areas. And one is the autism, the one which we know, which is called the classical autism,
Okay.
whereby the main difference between this one is the cognitive level is low.
Okay.
They take time to acquire what we call adaptive behaviors.
Okay.
And most of these children, half of them, they are mute.
Okay. Adaptive behavior.
Like,
we don't want to lose our audience.
Yes, adaptive
Okay.
behavior means ADL, activity of the daily living, like
yes.
dressing,
Okay.
brushing teeth, using the toilet.
Okay. So the basic things we take for granted.
Yes.
Okay. Yeah, we take for
They
like
delay
waking
to
up.
develop in
that.
areas
All right.
which a typical child has not delayed.
Okay.
Yeah, that's now the common classical autism child.
Okay.
Most of them are mute,
Mm-hmm.
and some also have a collab.
All right.
Which now, what we are saying about high functioning is what also we call the Asperger's syndrome.
Okay.
And when we talk about the Asperger's syndrome, the developmental even in language is okay, up to a level when they go to maybe 4 or 5 years.
All right.
When now, because their main issue is not the communication, they're able to use the word, they know the meaning of the word, they're able to understand it, express themselves. But now the main issue is come now to the social use of language, or the contextual use of language, which we call pragmatic use of language.
Okay.
And when we talk about the pragmatic use of language, is to know what to say, when to say, and where to say it.
So the people who just speak without filters,
Yes.
like they'll say whatever they think without minding your emotions, without minding how you will feel or what forum it is.
Yes.
So that is the high functioning.
Yes. And you see this, they thrive well in most of the areas, and they can even fit in a regular school.
Okay.
Yeah, but they have some challenges, especially when it comes to the imaginative skills.
Okay.
I had a child whom was not able to imagine in year 7. So he was told to write about an essay that one day I was lost in the forest. And he wrote, I've never been lost in the forest. Because he could not have imagined. And you see, imagination also deals with the language.
Okay. Let me just take that in. So we're saying that, okay, I'm trying to imagine all the compositions when I was growing up that I was given. Like, I woke up in the morning, I had a band continue. So for them, that does not exist. The fact that you've actually prompted them that I need you to create this scenery.
Yes.
So that does not exist.
Most of them have difficulty.
Most of them, they have a difficulty in trying to imagine things.
Because you cannot separate language and imagination. They still go together.
Okay.
Somehow. Yes.
So the imagination part of our brain, how does it normally, okay, there is like when you're trying to, let's say, solve a problem,
Yes.
yeah, and that takes that you need to try come up with the situation, like if this goes wrong, I picture myself that this has gone wrong, then get a solution around that. So that's the part that is challenging.
But when it comes to the concrete issues, they are able.
We're talking about facts.
They are able.
Yes.
Yes, you give them a puzzle,
They can sort it out.
they can sort it out. And that's why some of them they are very good in IT, in the computer, in design.
Okay,
But now when it comes to the component of the language only, that's where now they have an
so when it's language plus, they are very good at it.
Yes.
Very good at it. I'd given an example of this actor called Sheldon in the Big Bang Theory. He's like a scientist. Like, he can tell you all the aspects of the table of, you know, the scientific aspect, the chemistry,
Yes.
the eclipse, how the universe and what neutron and krypton and, you know, those very complex things that we see to be very hard to actually, I could say that's why we fail in our physics and, and chemistry in school. But so this is a plus. Remember I said earlier, I think they have superpowers. It's just that we look at it, we like tend to focus on something different.
They have a plus, but if you interact with them, you see that their communication will always lean to their own area of interest.
So if I like this, you will talk about what I like.
Talk about it.
Okay.
So if someone likes maybe cars, you bring about it was raining. Along the way, you will still bring the issue of the car. Yes, it's raining, but the car cannot pass through the mud. You see, so any conversation which you bring, it says go back to his own interest.
Okay.
See, now when in communication, still that is That's a big issue.
Okay, because you need them to move out from what it is your comfort zone, and try and imagine a different scenario.
Yes.
And that's where they have the challenge.
Yes.
Right?
And also they also don't know the social cues.
Like I'm hinting, like, you know, the way we try and communicate, like if I wink at you or I do this, that means let's go or something. They can't process even that.
They have difficulty.
Okay, they have difficulty, but it's something that we can train. We can train them or something.
They must. You see, to another typical child, it comes just without. They just acquire.
It's an acquired skill.
Yes, but for them, they must learn that skill. Most of them, and they must be trained.
So when, as a teacher in class, I believe you have a lot of work. I'm just trying to process all of these types. I'm trying to imagine. So as a teacher, I have to figure out this boy A is high functioning, boy B is low functioning. I have to custom make boy A's classes so that I teach him according to what he's strong and work on his weaknesses and all that. And then come to boy B still, if he's low functioning, try and improve him on the other side. So how hard, how easy is it to maintain the children? How many children do you have in a class, first of all? 7 at a sitting. So when you're doing your therapy sessions as a teacher, is it like you deal with, okay, I'll just develop, you'll allow me, because I'm always intrigued by how teachers have patience, memory, you know, like you have your own superpowers of your own. How, when you have all these children, is it that, do you cluster them? Like, these are the Asperger's, which you said is a high functioning type of autism, and then do you have like the mild autistics, and then you have the low functioning. Then you deal with them and leave them with activities. But just dive us into your life, your daily life of teaching and speech therapy just a bit. And also, when you're doing that, you can also let us know, like, how exactly do we train the children to be able to acquire speech, if it's not too early to dive into that? At your pace, teacher.
Good, thank you. Now, here, when it comes to speech, and we are talking about, someone said, when you see one child in the spectrum, you're only seeing one.
Okay.
Yes. So we do what we call individualized programs.
Okay.
So each child has their own needs. Because you see, in the spectrum, they also come with their own behavioral issues, which are totally different. And when it comes to a child in the spectrum, the speech therapy program is totally different from other neurodiversity.
Okay.
Because they have issues with social skills, they have issues with the sensory issues. Some come with issues of attention and
attention.
You see?
Yeah.
So a child comes with their own, his or her own package.
So you deal one-on-one, like customize everyone their own.
There's someone who just come with the speech issues. And let's go back, speech and language, they are also different.
Yeah.
When you talk about the speech, it's how the sounds which make a word.
Okay. Speech is the sound.
Speech is how you say words. Yes.
Okay.
And let me give you an example. When it comes to the speech, we have 3 categories.
Okay.
We have the articulation issues. So if I want to say banana, and I cannot say nanana, that's a speech issue.
Okay.
It's not a language issue.
Okay, because I can say it. I can say it, so it can come out.
It can come out.
Okay.
When I say about banana,
so
that's a speech issue, which is a voice.
It's a vocal.
It's a voice disorder,
Okay.
but it's a speech issue. When I say banana, that's still a speech issue, but now the stammering, but it's a part of the speech.
Okay.
You see?
Yes.
So you may get a child who is in the spectrum, but they still have the speech issues and the language issues. There's someone who does not have the speech issues, but they have the language issue.
Okay.
Yes. When now we come to the language, we always start with from the semantic.
Okay.
Do they know the meaning of this word? If I say cup, do they know what cup
is?
A child who is very good in a Colada will say cup. Cup. Book, pen.
Because it's repeating, basically.
It's repeating. But if you put that pen there in the book and then you ask, pick book, will they be able to pick the book?
No.
They cannot attach the word book
to what
it represents.
The actual.
Yes.
So if I say, give me that pen,
yes,
they will not understand what it is that I'm saying.
Understand.
Okay.
And some parents come to us and they say they understand, but sometimes they understand through the context. Maybe you are going out and they say, let's go out, get your shoe, we go out. So this child know that getting out of the door, he must have his shoes on.
Also in the way you put it in a contextual form,
yes.
like this activity leads to this, so
yes.
they attach whatever you're trying to tell them. Yes. But so how do they relate then in that full sentence that going out and shoes? Is it that now you keep saying the same thing over and over again?
And they know that they cannot be allowed to get out without their shoes on.
So the minute you come and you don't have your shoes, I tell you stop, go wear your shoes.
Yes.
So that way they pick, this is a shoe.
Yeah.
But isn't that so slow a process of teaching a child? I'm trying to imagine how frustrating that can be.
Yeah.
But so do you guys as teachers get tested on patience?
Yeah, you see, for you to be a teacher, the very first thing is, especially a teacher to a child with a special need.
Okay.
You must be patient, and you must be firm and gentle at the same time.
Define. I'm glad you've used that word. Explain. Patience and firm.
Yes.
So where do you draw? Okay, you throw in a third one.
Yes.
Patient, firm, and gentle. How do you draw the line?
And especially to a child
with special needs.
Special needs, especially child with some behavioral issues.
So
autistic.
So autistic, behavior issues, and then language issues.
Yes.
So you have to deal with all these moving parts for you to be able to actually, first of all, get them to listen, learn, and get to understand. So, is it like a God-sent grace? Or,
no,
I'm just trying to put myself in your shoes as a teacher for 18 years. This is what you've been dealing with, like every day, day in, day out.
You must, especially when it comes to the speech and language. If you know that the child can be able to say, and they just want to point.
Okay.
So you decide that when you point, I want to respond.
That's
until you say.
So that's being firm, or that's being...
That's being now firm, and also gentle.
Gentle. Okay.
So you also don't become harsh to the child.
Harsh meaning like shouting at them and stuff like that, and punishing them because they did not respond to your directive.
Yes.
So when a child chooses the form of communication, because I know that's something that I experienced as a mother, because before we could develop language, for me, I'd say that's something I appreciated, because Andrew at that point would come and hold my hand, and if he wants to, because he was not saying milk or whatever it is, you can tell he's unsettled, but he'll take your hand and take you to the fridge and point. So for me, that was a relief.
Yeah,
as a parent, because he can show me what it is that he wants, so I'm less frustrated.
And you see now, that one is language, but you are saying that he had no language, but he had what we call non-verbal.
Non-verbal language.
It was there.
Okay, so language is a form of communication, whichever way.
Whichever way. It can be non-verbal, it can be verbal, it can be written, it can be signed, like the way she's signing. Yes.
Okay.
When you go to the mall, there are some symbols.
Yes.
So you see James. Right now they don't write the word gent, but you can
just see a command.
Yes.
And I can know that is gent.
Yes.
But so how do they?
That's a way of
communicate.
That's
language.
Symbols.
Okay.
Yes. Signs. When you are driving, you see stop, no entry.
No entry.
They don't write no entry, but
just,
you see
there's a sign.
Yes.
Okay.
But now you know what that means.
Okay. So we've said. So where does the patience come in? In as a let me call it a virtue, like we've said, you have to be firm, you have to be firm, patient, and gentle at the same time. I consider the times that I've said this 20 times, why are you not getting it? That is me being frustrated. So I need to be firm in that I do not budge when I'm trying to change. Let's say now the language of I want to encourage the child to use their voice instead of using the technique of pointing and stuff like that.
Holding your hand.
Holding my hand and taking me. So how do I implement that firmly, gently, and at the same time? What was the other one?
Patient. Because
patience.
You don't expect if you achieve. So that's okay. If it takes time, if it takes longer to achieve, that's normal. Okay. If at all you want to achieve, you tried.
I tried. I can say at least I tried.
Yes. Let's viewers know this, that there are some children in the spectrum who never acquire verbal language.
Yes.
Yes.
So that means they stick to either taking your hand to show you or pointing and stuff like that. So that is
Yes.
the way they learn how to do it.
Yes, and that's where now we come as professional. We come with what we call alternative, augmentative.
Oh, right.
Yes.
Alternative what again? Say that one
Yes.
again. Alternative?
Augmentative.
Argumentative.
Yes.
Okay.
Augmentative,
Uh-huh.
Yes. And this whereby we use like pictures.
All right.
What is mainly called PECS, picture exchange communication.
So, that's the full word of PECS. I've had
picture
that a lot.
exchange communication system.
Okay.
Whereby,
Mhm.
if this child is not able to speak,
Mhm.
but they want to use the washroom,
Mhm.
so they can pluck a photo of a
Mhm.
washroom and then they show you.
So then that tells me that they want to go.
They want to go.
So how do they tell me if it's a long or a short?
So once they show you,
Uh-huh.
when they go there, they do their business. Because here we are trying to reduce the frustration
Okay, yes, that's true. That's
between you two. Yes, yeah. You see,
Okay.
here there is the listener
Mhm.
and there is the speaker.
Yes, that's
The speaker is a child
yes.
in the
Mm,
spectrum.
Spectrum.
They want to go for a call.
Mhm.
They cannot say it.
Yeah.
Yes, they don't know how to write.
Mhm.
They cannot use a sign,
Mhm.
but they are very good with the visual.
Okay.
So they can see this is what I want. So
Mhm.
they show you,
Mhm.
and then you understand what they want.
So the visual, when it comes to PECS,
Yes.
which we have said is picture exchange communication
system.
system.
Yes.
So it takes a while for them to actually relate this picture means. So does it mean when you're teaching them, like if I want to take them to the loo for the first time, let's say I'm a fresh parent, I want to introduce PECS in my house. So I take them to the toilet, then I show them the picture so that they relate.
Yes,
That's exactly how you do
because
it.
now even the PECS, if a child the cognitive ability is low,
Cognitive, which we said is the relating
to
like putting things together.
yeah, the IQs,
The
and
IQ,
reasoning,
okay,
and also
alright.
the matching, and all
Mhm,
those.
mhm.
If a child cannot be able to relate these pictures
Mhm.
and the real thing, you still have an issue.
Oh, God.
That's why they are saying that when it comes to speech and language,
Uh-huh.
the speech and language therapists don't work alone
Oh yes, you have to work with
in a multidisciplinary.
multidisciplinary session. Okay, so
Yes,
what is
approach.
this? Who exactly, when you're talking of not working alone, who exactly are we talking that we should be adding into the conversation when you're trying to
Yeah.
teach a child speech? Who else should be involved?
You see, from the word go, we say that we have to rule out the hearing
Yes.
if we suspect.
Okay.
So you have to work with an audiologist.
Yes.
If there's some hearing loss,
Mhm.
however minimal, you still have to work with audiologists.
Okay.
So here, if there's some sensory issues,
Mm-hmm.
you have to work with an OT.
So when we're talking about sensory issues, it's some of the things that we had said that they have, like, they hear things differently, see things differently, feel things differently. So when we have the children who, like, when we're discussing about pitch, yeah? So when we're talking about them having that they hear so much, like, it could be something, a low tone, but they hear it very expansive, right? Then we have those ones who hear even like a pin drop. They can still hear. So that's still part of
Sensory.
that is the sensory side,
Sensory,
a sensory
yes.
side of it.
And,
Okay.
and you see, if a child has some high sensory overload,
Mm-hmm.
that they always block their ears.
Mm-hmm. Mm-hmm.
And we know for you to acquire language or words, you must hear this
Yes.
one.
Yes.
So the child is always blocking his ears.
Yes.
So will they have an issue with
Yes.
acquiring words naturally? Yes,
Yes,
they have.
they will.
So you have also to work with that.
Sensory on occupational therapy.
Yes, who deals with the sensory integration issues?
So,
Yes.
sensory integration issues. So that means they try to get them from that discomfort
Yes.
of hearing too loudly to try and bring it down to a regular. Let's call it
Yes,
regular.
yes.
But how can you adjust that? I know we have the earmuffs
Yes.
for cancelling excessive noise, right? That is one way, right? What is there any other way?
Yeah, there's what we call AIT,
AIT.
auditory integration therapy.
Okay.
Yes.
We have so many therapies, man.
Yes, so many therapies. But I think it's only 2 people who are doing it here in Kenya.
2 out of the masses. We're talking of autism being 1 to 58.
Yes, yeah.
That's the numbers we're dealing with. So when we only have 2 in Kenya, so want to our children. Not want to our children, but that's a big problem. So I'd encourage the people who are in school, that is one of the areas you can actually try and get into so that we can be able to assist our children better. That means they'll be better integrated into society. And I'll ask a question. I'm looking at time is not on our side. And I think we might need a part 2 of this.
Yes.
Yeah? We have to. It's a very big topic, my dear viewers, that we have seen.
Because already I've just said about 2 types of autism.
We've only touched 2.
High functioning, which is Asperger's,
and
the classical autism.
And the classical autism.
And then there's the PDD, pervasive developmental disorder, not otherwise specified.
Wow.
Then we have the Reid syndrome, which is only affect girls.
Yes. So how about we say to be continued next week? Is that fair?
Yes.
So next week, same time, same place. But before that, we had a question. A friend of mine asked, where do you study speech therapy and for how long? How much is the fees for the same? And in a classroom level, how can you help a child to develop speech?
In a classroom level.
Yes, because you are a teacher, so I think that was squarely placed, like your profession versus what exactly it is you're doing. Yes.
Okay, let me first answer the first one. Okay. Right now, Kenyatta University is offering this course.
Okay.
But at a master's level.
Only in masters.
Only in master's level. But you can go outside Kenya, India, UK, USA, South Africa. You can do it. KU is a master's program of 3 years.
3 years.
Yeah, there's 2 years theory, there's 1 year internship.
Okay.
Yes.
Internship meaning you have to come to the school and actually work with the students.
Mainly to mold the seniors with therapists, you must be attached to them, but because it's a more of a clinical course, so there must be an internship.
Okay, I know we had touched a bit about with her last question about the classroom level, yeah?
Yes.
Is there anything that we should touch on, or can we make this for next week? What is your view? Is it something you can summarize just for her interest?
The classroom levels always depend on individual and the type of autism and the level and other behavioral issues which are there.
Okay.
Let me give, you can do also pairing. There's a boy who is high functioning, so we have done the pairing. So we have picked typical children, 2 typical boys, to be with them. This child is in high functioning, and especially in what we call figurative language. This boy is able to communicate very well, but when it comes to the figurative language, like pull up your socks.
Figurative language meaning?
Idioms, metaphors.
Oh yeah, the hidden meanings.
The hidden meanings, yeah.
Okay.
So one day the teacher said, pull up your socks, and the boy went down to pull up his socks.
Oh, so they instead of like you need to pull up your socks in your studies. So they don't quite get to understand, like break it down to the complex speech is something that they have difficulty dealing with.
Yes, when it comes, they have what we call little meaning. Any hidden meaning give them difficulty to try to unearth what that means.
So that if you tell me, give me the cup, that's easy. I know I go, get the cup, bring it to you. But the minute I say, like, the apple does not fall far from the tree, I have lost them totally.
Or you say that yesterday it rained scattered dogs.
So they'll go looking for cats and dogs outside. Okay, your life must be very interesting, clearly. So we are talking to he said he's not a doctor, because he's a therapist. So there is a difference between a doctor and a therapist. For us, we always say we're going to the doctors. So we're speaking to therapist Asaf Mwangi Irungu, who's had 18 years of experience in education of special needs children and also in speech therapy, and he's currently doing his master's, right?
Yes.
On the same. So since we've not even managed to do 50% of what we intended to do today when it comes to speech and language, we shall continue this next week, same time, same place here on Science TV with me, Sylvia Moramo Chabo. And our interpreter for today was Maureen Maitha. Thank you, Maureen, for being a lovely interpreter. So that means we have included everyone. One of the things that we encourage here at Science TV and at Andy Speaks for Special Needs Persons is that we leave no one behind. In that, those who are hard of hearing are also included in the conversations that we have, because they face the same challenges that we face as persons who can actually hear. Don't forget, if you have any questions, you can talk to us on our Facebook page, Andy Speaks for Special Needs Persons. You can also talk to us on Twitter. My handle is Mora Sylvia or Andy Speaks 4. And on Instagram, you can send us a message on Sylvia Mochabo or Andy Speaks. Sylvia Mochabo or Andy Speaks, or even you can send on Science TV, but you have to do the hashtag Neuro Digest so that the question can be directed to the episode today. Thank you for being with us. I'm your host, Sylvia Mora Mochabo, on our 6th episode of Neuro Digest, and we have said stay tuned next week, same time, same place, as we go on with speech therapy, and we shall expound more because we've not been able to exhaust. So do have a lovely evening, and we see you next week once again right here on Science TV for Neuro Digest. Sleep well and be blessed.